Hello, I'm Sana Khan, and you're watching Medicircle. Today we have with us Dr. Vivek Kaser. He is an Associate Medical Data Review Manager at IQVIA. Please welcome him to our show, Rendezvous on Patient Safety Series. Hi, Dr. Vivek, how are you?
Thank you, Sana, for the warm welcome. I'm good. How are you? Thank you.
Thank you so much. We're fine. Okay, so to begin with, uh, patient safety is a global health priority, hence proved by COVID. What are your thoughts on the same?
So yes, patient safety definitely is a top priority. As an individual level, from the patient's perspective, as well as from the from the doctor's perspective, because we are the healthcare workers taking care of the patients. Also, from if you look from the broader perspective, it is important from the government or agencies which are responsible to take care of the patients
Mhm.
or for the people.
Right.
So it is definitely like an important factor which has especially emerged out during this COVID pandemic. The
Mhm.
reason being is because nobody has actually anticipated that COVID would play, such a catastrophic role in everybody's life, and nobody was prepared, how to deal with the situation, how to make people basic etiquettes or basic things which people normally take it for granted, to make them
Right.
now understand, it is how important that is. So I think it is definitely this pandemic has given a lot of insights to us, to the patient, or to everyone who is around us, to understand how and what safety is to them, and also safety to the other people. So definitely, this definitely has this COVID pandemic has proven a lot in terms of patient safety. Yes.
True. The theme for this year's Patient Safety Day is Safe Health Workers, Safe Patients. What is your contribution towards the safety of the health workers?
Apart from just whatever we have been instructed by the as following the guidelines, say wearing PPPs or wearing mask at the public places, using sanitization
Mhm.
at home or at workplace or while traveling. Apart from that, also giving training is very important. From a person who has not never been exposed how to wear it, to
Right.
even train them to how to wear a PPE, how to wear a mask, because normal people, they do not wear a mask. So you even have to teach them how to wear a mask. These are basic etiquettes which you have to teach. And for healthcare workers, definitely we are more accustomed to, or maybe more used to all these things, but still, inculcating or imbibing those habits. So supposedly, for example, I would say, in a hospital setting, especially where I worked was emergency setting. You
Okay.
see a lot of patients, you even don't have time to take a breath. Now in that situation, if you're asking me to sanitize after seeing, or touching one subjects and going, or maybe even touching a file and going touching to another subject's file, I'm not talking about touching two patients, from one file to another, you should use the sanitization properly. So those things, even for me it was difficult, but you
Right.
have to take a lead, and you have to set a precedence, so that people around you, the nurses, the housekeeping staff, everywhere in the medical fraternity should try and follow it. And that is because we do not have cure, we do not have anything but the prevention. So we are wearing PPEs, not the subjects, not the patients. So we do not want to expose them. So we have to take utmost precautions to safeguard ourselves, and also to take safeguard the interest, or the life of the patients who are around us. So yes.
This is the digital age, and healthcare is highly influenced by technology.
Mhm.
How do you think this transformation will support patient safety today?
Okay, so this is a very pertinent to what I'm doing today. So I work as an associate medical data review manager at IQVIA. So here, like, I we work in a digital world. We get lots of clinical trials which are going on. We get those datas and we review those datas, make clinical judgments out of it.
Mhm.
However, like, no, in before this COVID pandemic, we used to have, like, regular follow-ups. We used to deploy people to
Right.
follow up. However, because of this COVID pandemic, we cannot
Pandemic.
risk the life of a person to go, or, like, go out of the house and go and visit the facility to
Right.
check some documents. So digitalization of those documents, so that it becomes easier for the person so that they don't have to step out of the house. So minimizing those things is definitely played a, like, an important role. Again, for talking about COVID, so testing for the COVID, we are talking about something which is very invasive, I would say, although people may differ with me. But taking a swab from the mouth, taking a swab from the nose, it's not a very it's not just touching the skin, like you are going in. So these are invasive procedures. Now we are devising certain things with which we can take or maybe presumptive actually analysis done for the subjects, or like for people who can be high risk of getting the infection. I'm not just talking about Arogya Setu. Obviously, it's a
Right.
very good app which is launched by the government of India, but we are talking about more and more definitive answer towards the diagnosis, and not just like you are at high risk, but telling them, like, how important is for you to go check, or, like, when and where to
Get the tests
you
done and
schedule that.
everything.
Yes. So definitely, like, more and more digitalization is helping, especially during this COVID pandemic, when nobody actually wants to step out of the house, but at the same time they want to get the things done. You cannot just you
Sit
cannot
at
just
home
sit
and relax. Right.
and, yeah, do nothing. So you have to get the things done. At the same time, you have to take utmost precaution not stepping out. So yeah.
Diagnostic errors, healthcare acquired infections, medication errors, readmissions, wrong site surgery, and communication are the major patient safety issues. How do you ensure proper safety, patient safety?
So these are done at various levels. From what I understand is, like, these are done at various levels. So from the first times the patient is seen by a doctor. So if a patient comes to me, I hear from the history. Then after hearing the history, if I have heard right or left, I'm just giving you the
Mhm.
example. Then
Right.
while I'm doing the examination, am I doing from am I touching the right side or the left side, where I'm
Mhm.
eliciting, say example, pain, where I'm eliciting the pain. So history examination, what you are documenting is important. How you are communicating to your colleagues or staff that, for example, if this patient is posted for surgery, then you have to mark the surgical site. So it should be very clear, and it should be stepwise, that everybody, everywhere, wherever, like, if, example, if it's right side, then if it is done at various levels, everyone should mark it as right. If anyone has marked left, that should be taken cognizance of, and you should try and rectify, or maybe revisit, to understand why
Right.
this person has marked as left. So
Mhm.
this is what, like, for the surgical side, sometimes wrongly placed, that sutures, or wrongly placed surgical site can go wrong. For medication errors, now, like, slowly, I believe uh, that we are more going towards the digital frame. So I'm seeing more and more doctors often writing the prescription on their, using their laptops,
Right.
rather than having a hand,
The
like a pen and paper.
e-prescriptions these days.
Yes. So,
Right.
e-prescriptions, or, for even for consultations, now they have
Mhm.
started giving you the printed ones, so that
Right.
the small mistakes, or the interpretation should not go wrong. And definitely we are going more towards the generic medication, so that
Mhm.
there should not, because there are two medications available in the market with the same brand names, but we are talking
Right.
about two different contents. So what content I want to give, I should write that. So that is called generic. So we are going towards more of generic to avoid this medication errors. Pharmacy, we are I think I cannot speak on behalf of pharmacy, but I think government of India has the agencies are tightening a little bit, so that the pharmacy or the pharmacist should take the profession, the job seriously, and they should give the medication what has been prescribed. If they have any doubt, they should rather consult a doctor, rather giving any medication which they feel can be this medication can be the one. So these all things are being done to minimize the risk. Although there can always be the risk, but we ensure that we minimize it to the minimum as possible to ensure the safety of the subjects, the patients.
Okay, thank you so much, Dr. Vivek, for coming to our show and giving us your valuable time and insights for our patient safety series at Medicircle.
Yeah, thank you, Sana. Thank you so
It was a
much.
pleasure having you. Good day, sir.
Bye bye.
Bye.